Can anybody on Zoom just confirm that you can hear us okay?
You can enter in the chat. I heard something. If you can hear us in the room, can you enter in the chat?
Yeah, it looks like it's all working. Yeah. We checked it all. Yeah.
Microsoft, is that the one? No, you have to be on Samsung, right?
This one is, yeah.
What about the speaker?
Nope, that worked.
That's correct?
Yep.
Some people can't hear that.
Can anyone on Zoom confirm they can hear us?
You put it in the chat.
Yeah, I can hear you.
Okay.
Okay, thank you.
Perfect.
Yeah, anybody out there?
Yeah, okay. It all looks like it's working, so.
All right. Good evening, everyone. Thank you for joining us this evening. I'll call the meeting to order. This is a special meeting, so the only item on the agenda is really to discuss the charter revision and the changes that are proposed with the revision that directly affect the VNA. And so I'll ask Aaliyah if you want to open it up, or Mark. You had wanted an opportunity to be in front of the VNA. I mean, I can speak on behalf of several people who have brought things to my attention. And again, for those of you who are new into the room, I assume the role of the chair in, I believe, February of this year. I joined the board last September after there was a call on Facebook. We love social media, because the board for the VNA was not a complete filled 12 slate of officers. My background is 25 years in healthcare. I worked for Massonicare. For those of you who may or may not know it, at the time, it was one of the largest home care agencies in the state prior to Trinity and Hartford Healthcare kind of gobbling up the state. So my background is in risk management operations. I have a strong understanding of visiting nurse operations. So when the call came for me to join this board, it was like a calling to come and help out, something that I have worked in for 20 plus years, town resident in Berlin, and there was a need. And so I then was nominated to be the chair in February after the prior chair stepped down, because I understand he moved out of town. So here we are. I met Aaliyah when she joined in April, and so have been working closely with her over the past few months to really get an understanding of the operations, just given my background. Also, I think prior to Aaliyah arriving, there was an operational assessment of the VNA that was performed by a very well-respected organization that does home care consulting. I worked with them in my prior life. They were Simeon Consulting and Blacktree. Combined, they became Symmetry. And so there is a 40-page assessment that I don't believe many members have seen of the town council of this assessment. Arosha, I don't know if you have a copy of it. It's very detailed and gives a big background of really what VNA operations were, where the organization needed to focus. And Aaliyah has been chipping away at that since she's arrived, and I call her a short timer. She's only been here for not even 6 months, operating in her role. Is it 7?
It's going to be 7. Yeah.
So again, just to give you all a little bit of a background, I think it's important to understand, my role, and then obviously Aaliyah, and just wanting to make sure we all understand, again, the purpose of the charter change. As I had indicated to Mark, finances, obviously, we know drive a lot of business decisions. Again, having worked in nonprofit healthcare, I get it. That being said, I will address the elephant in the room, because I think it's important to be very transparent about the word and understanding is that the VNA will be eliminated. And I think again, the answer to that question is what I think the group, those staff members that are here and audience members, it would be helpful to understand what within the charter restricts the town from managing the VNA differently than taking it out of the town charter, putting it into an ordinance, other than the people vote on the town charter, the ordinance are voted by council. Is that my understanding of how operationally that would be? So I guess the question is what changes in terms of operationally, pulling it out of the charter, having it as an ordinance from an overall management and the restricted ability that is said to be had now? I don't know, so it's my, for my own knowledge, I don't know the difference. So if you could explain that, I think that might help, you know.
Yeah, that's a big question from the staff too, and that's my question that I've asked, and we haven't been given an answer as to details, exactly what's different under the ordinance versus the charter. What things can't we do under the charter? What are you talking about? I'm looking for details.
And that would be helpful, you know, sitting as chair, knowing that that will go away. The board will go away ultimately based on the sunset plan. So it would be helpful. That's what it says in the.
Yeah, I think there's much confusion.
Yeah,
Okay. and
exactly,
It's not
yes.
helped by folks that are out there creating the confusion, which is upsetting, but folks that have been in our meetings and have listened to what we have said has been completely misinterpreted by folks in the public, which happens a lot on many issues, not just
It's
this issue.
politics, and I had said this to you.
Unfortunately, there are people
It's
bringing politics into
and
it.
it's not. We take care of people, not Republicans and Democrats. And I think that's important for people to understand that. And so that's why clarity on that question is helpful.
And the folks here are, just so I know, and I apologize, I don't know the board members of the VNA or
Board, and then we got Peter, Dave Veronese, and then myself, and then you have Dory, who's in the VNA office. She's runs the ship there, I think.
Right. Then we have.
Do we have a quorum?
School nurses, okay. Well, it's good to meet you all. Sorry, I haven't met you before.
Yes, Peter, we do.
Hey, Peter. I met Peter before and a few of you, Kara. So let's just go back to, we can go way back. We might start at the beginning so we understand maybe the genesis of all this. I think that's what a lot of folks, because many of you are new to the board. Kara's new, and you know, it's.
I think a bulk of people are new.
Yeah, so I can only go back as far as when I was elected to the council, and we did not have a board of finance back then. That's back in 2015, so into the 2016 budget year. That when we looked at the budget in 2016 for that next budget year, which was the 27 year, we looked at the VNA budget, and it was losing back then. I have all the figures. The loss was 300,000 or 400,000, something like that. I have the exact figures. We could always look at that, but you know, there was a loss. The question that was asked in that budget hearing to the town, you know, again, we're the council, we're the elected officials, we're you know, setting the budget. No one even knew they were operating at a loss. I mean, that was the first question that astounded me, you know, resident of Berlin, lived here most of my life and was on planning and zoning before, now on the council, that, you know, budget's a budget, and there was no answers of, they didn't even know it was a revenue loss. And that was kind of the start of it. We tried to say, well, let's try and fix it way back then. We've tried to look at it. We've got that, you know, consultant report. Finally, we got that. I don't think you haven't seen that at Roche, right? Have we seen that yet? Yeah, the report that they mentioned earlier. Okay. So, I mean, and that's up to date. Anyway, so then we went to a board of finance, and there's been a loss from 2011 to now. In fact, the loss, let's just get the figures because they're a little.
Even as we try to fix it,
Which we have. You know, we've been looking at it for a while. We've tried to obviously tone down the loss. So in 2011, we were at a net loss of 307,000. 500, 500, 700, 770, 2017. 2021, we went to 935,000. We're on $1 million loss almost, okay? And then we're back to 2022 with 790,000. So it's been up and down through the years. And again, we've looked at it, we understand. So, and I liken it to the golf course. So the golf course, I know it's not providing nursing, but they do
It's not a
provide
good, I
service.
almost, that's not a good comparison to
Well,
compare golf to
well, no,
healthcare.
what we're looking at as far as how it works, there's no other town department that really provides services like you
Right, but you're
do.
talking about an insurance reimbursement versus a
Right.
pay for fee serve
Correct. But
leisure sport. I think that that's not Apple. I'm just being that
but-
this is some of the chatter
but
that's
it-
come up.
the
Mark. So
analogy is this, ignored again for many, many years, operating at a loss. We had town employees working there and we had, private contractor, the 12
Yep.
Pro. Ignored for many, many years at a loss. When I took office, I had the golf pro talk to me, who's still the golf pro, and said, hey, look, things aren't working that well here. Nobody pays attention to us, blah, 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 blah. Kind of the same story hearing about the VNA. Nobody has paid attention to you folks with the budget and different things.
Yep.
And we fixed it. We went in with the golf commission and we looked at it and we did the best we can, and now we're in the black. So we didn't change anything. We didn't get rid of any employees, but we turned it around where it's at least breaking even, and now it's actually in the black. So, I'm not comparing it to nursing services by any means, but I'm just telling you that that's what has happened, and it's
yeah,
just
and
a
that's
similar
understandable, but
circumstance.
I'm sensitive to making sure
Yes.
that the council is aware of comparisons that are being made that are coming to my attention as the
Yes.
chair. I think that's my role, is to
Sure.
make sure that
Sure.
all sides hear what's out there, because that's the
Right.
only way you get through questions and doubts. If we don't, we're not transparent with what's being talked in different,
Yeah.
Well, and I just have
Cohorts.
another just kind of
Well-
point on that. As an insurance reimbursed agency, we don't set the prices like the golf course maybe could have adjusted their prices because they
Get that.
did things like that's not a
It's not,
possibility.
I'm
So,
not making an apples to apples argument. I'm just saying it's a similar circumstance in that it was a town department, town-owned asset that was losing money for years. Nobody paid attention to it.
so can you give examples of what was changed at the golf course
We
to make
changed a
it
bunch of things.
successful?
I mean, I'm not gonna get into the whole plan of what we changed at the golf course. If we just
Can you give
agreed
like
it's
a
not-
couple examples?
Well, we've changed the staff, the way we staff it now has changed. We just have a new director of golf we're hiring, one director left, and the golf probably just renegotiated his contract. He's doing different things.
Okay.
And we've changed the way some of the operations out there. And that's gone through, we're at probably in the second town manager that started looking at it. It took a while. It didn't happen overnight. So there are things we change, and I'm not saying all that applies to you, but it's the same type thing. When we started looking at it, we had the same resistance, I guess I'll say, from other town employees that were they're going to lose their jobs and different things that I have heard, through this.
And I think that
Artist
that's a
argument.
realistic, I think,
Sure.
concern from anybody who's
Yes, it is.
impacted. And again, not to keep bringing things up, but a concern based on quotes that, again, in the Herald that the town attorney made about sunsetting the VNA and getting another provider in there. So that's a direct quote from the town attorney. So
Direct
answer,
quote though, was it true or did the?
I
Herald-
don't know,
Yeah,
but it's
that's the
out there.
problem.
And if it's not disputed or clarified, then that's where the chatter. So again, Charlie, I don't know if you have something. to
Yeah,
add.
let me just get through the history, and then Charlie was obviously the chair of our charter review commission. The thing about the charter review, and he could speak better detail probably than I can, even though the council approved it. The way it's written, the day, let's say it passed. Let's just say it passes the vote on November 8th to take it out of the charter. The way it's written is we're not doing anything immediately. That is not the reason for it. The reason for it is if we go forward and try and fix this, which we need to do. We don't run towns at a loss like the town departments at a loss. No one runs at a loss like this. We run at a surplus in most town departments. Understandably, you're different, but again, we have to be somewhat fiscally responsible. It's taxpayer dollars. I mean, that's what it's about. It's providing healthcare. That's number one. We've always said that. That's our goal. to take care of our patients. We've never not said that. So it's very irritating to me personally to see social media out there saying things that are completely wrong, not how we've characterized it at all. This is a bipartisan, Democrats, Republicans. If we want to make it political, we all voted together on this charter change. The Charter Review Commission voted together, Republicans and Democrats. We all voted together. We didn't make it political. It's not political. It has nothing to do with politics. People are making it to be politics, unfortunately, out there, which is disturbing to hear, but whatever. That's the purpose of this meeting tonight. We don't want to take it out of the charter. That's not the goal at the moment. How we really, if you listen to all the discussion, and Charlie will fill you in more specifically than me, that it was if somewhere in the future, I don't know when that is, it's not next year, it's hopefully not the year after that, maybe never. If we find some wonderful solution that somehow the charter language won't let us do, we could take it out of the charter, pass an ordinance, and if we had to fix something that worked, we try it. The goal is not to take it out of the charter anytime soon. It's to leave us an option down the road if we need to fix something that can't be fixed within the charter. I don't even know what that is. None of us know what that is. But it's an option we're looking for to help us if we need it. If we need it. And I guess the one big misconception too, people are worried about their jobs. Okay, I understand that. And we're very sensitive to that as well. And of course, we want to keep the care level the best in the state. Just because it's taken out of the charter or left in the charter doesn't mean jobs cannot be eliminated. That's another misnomer, and that's not what we're looking to do. Please, I hate to even say that, but that's the fear I hear from some of the staff and people that, oh, you're going to eliminate jobs. No, that's not the goal. Is to keep the jobs, but we can't keep operating at a net loss, and we have to figure out why we operate at a net loss. Do we even know the answer? In 7 years, I've never heard any answer why we're operating at a net loss. I've heard consultants have come and gone. A couple others, different directors have come and gone. We've worked on it. Arosh has worked on it hard. Board of Finance looked at it. Council looks at it. We paid attention to it. And when I hear sometimes, and I think some of this, I don't know where it's coming from the staff. We don't want to hear from them. And I asked to meet with the staff. They don't want to talk to me. That's not open communication. If they're concerned about things, or if they have things to tell me, or the council, or come to a council meeting, come to a Board of Finance meeting, we're happy to talk to staff. We are the elected officials of representing the town, so we want the town to work. We want the VNA to work. It's just a complete mischaracterization of what we're trying to do. I don't even, it's very, very frustrating. As the mayor for the last number of years, we're not looking to get rid of the VNA. That's never been said ever in any council meeting. Review it all. Go back 5 years, go back to the beginning, go back to 7 years ago. I mean, that's as long as I've been here. We've never said that. But the loss, I mean, how do we go from 300, now we're up to 900,000 last year? I mean, that's something's got to be looked at. We have to try and fix it. I'm sure there's probably a way. Maybe we haven't figured it out yet. I don't know. You guys are the experts more than we are at the council. But I also look at the VNA board. The VNA board 7 years ago was not aware of the loss. And I've looked at some of your minutes of your recent meetings. You don't even talk about that, right? You talk about services and the different things that you provide, but you don't seem to be involved. And I didn't study your bylaws. I looked at them briefly, but you don't have any budget discussions at all from what I've read, at least the last
I haven't
year.
seen a budget as the chair. So, and
How
that's,
could that be? That's what.
and
you're-
it wasn't, and it wasn't,
do.
right, and it
I-
wasn't
I don't get that.
prior to me coming on board.
Yeah.
So in terms of board orientation,
Right.
we could go down a really, a path in
Yeah.
terms of that.
Yeah.
So I've asked the questions, and I know I've met on my own time with Aaliyah.
Yeah.
About quality metrics, because that quality drives finances. So if your quality is poor, your reimbursement's going to be less.
Yeah.
There's been other changes in the payer mix with the payment-driven grouping models that have come into play. That's a huge thing where it's not a therapy-driven cost, and therapy is a revenue generator in home care. So there would be a lot of explaining, not so drastically from a $600,000 potential change in revenue, but it would make sense that there would be a deficit in a loss when you're changing your model based on what the government, CMS, is reimbursing for your care. Your care is there and it's in episodes, so you're billing more frequently than 60-day episodes. Now you've gone down to 30-day episodes in the care. So it is a big undertaking, and I can see, looking at people in the room, you have absolutely no idea what I'm talking about. And I think that's the concern of Aaliyah, as well as not having an understanding of the operation financially and how it impacts the ultimate bottom line, I think is a huge gap. And I think we would owe it to the town itself with the VNA to have an understanding in order to make those changes. And so that's where the questions come up. Well, what's going to be different? And there's no answers. And I think that that's where the chatter mark, quite frankly, if you don't have
But
if
what's
you
gonna
don't
be
have a
different-
messaging, if you don't have messaging coming very clear,
Right.
succinct, and to the point,
Right.
it's now left to the people, just like parking lot chatter and gossip.
But-
That's
but
what it
where-
ultimately
Where has
turns
the
into.
messaging been from the VNA board? And not you, you're new, and most you folks are new on the VNA board. We're going back 7 years. We've asked this question for 7
I
years.
can't speak to the history.
No, I know
I
you
can only
can't,
speak
but
to
we
since I've
can't-
been
We
involved.
can't just let it go on. I mean, that.
And I think I've been very involved and
Yeah.
also involved with Aaliyah and being a support to her and actually understanding her language, I think has been very
But
helpful.
you don't talk about it in the VNA board. Shouldn't that be one of the things you do?
We talk about payer mix. We talk about she'll talk about
The loss,
CCCI
the losses
patients and
and-
how CCI patients are gonna cost more money
We
because
did
they're
talk about the
chronic.
deficit.
We talked about
And
the
are there-
deficit. We
are there-
absolutely did.
Are there solutions?
Can I say something?
Yes.
Yes, Dr. Scherzer.
It's frustrating.
I'm a physician.
Yes.
I've been
Yeah.
involved in this institution probably the longest.
Oh,
in
good,
this group.
good, great.
What I can tell you is it's usually driven by staff. Whatever we get presented during the meeting, we discuss. And the agenda for the meeting is presented by the staff. And sometimes the board will ask questions, and those questions are going to be addressed next, and sometimes they get addressed, sometimes they don't get addressed. But I agree with you, there has been a lack of communication. The situation is complex because the nature of the business that VNA is running is difficult. I think you can throw in the COVID that created another very difficult business situation
Understand
for so maybe last year or the year before that was also in a mix. But also we have been going through a lot of leadership changes in the last several years, and I think that has been very important in the loss because there has been, I think some of it can be really connected to the leadership that has come and go for various reasons.
Absolutely.
Now, the Berlin VNA is providing, I think, unique services in a way that it's, patients that are seen by different agency say different things about those agencies versus Berlin VNA. Whether there is regarding the business decision, I cannot answer that. That's not my point and my level of expertise. But I can tell you, I think we can try to reach out to you guys. If you can reach out to us, we can try to work hard at it. But it's a difficult situation because we do what we are presenting, and we try to
As the board,
Yes.
yeah.
and,
no,
and
I
we
get
try
it.
to discuss this
Mhm.
to a certain level.
Right.
And again, you are here fairly new. I cannot blame you for anything, but it has been varied in the past and varied according to the leadership that was
Yeah.
at the head of the VN agents. Another thing is, you know, there is a lot of different things that you can discuss here, you know, business wise. You know, we were trying to provide services mostly to Berlin residents. Well, then it becomes kind of like a military. You provide very expensive, you have to have certain amount of staff, and you cannot, you know, provide services without staff available. So you pay the staff, and if the staff is sitting idle, that is losing money. So we expanded that. We're trying to market in a varied way, and we're trying to come up with a you know, novel ways of trying to market to different sources. And also the reimbursement is changing, the business market is changing. You know, there are big agencies that are kind of swallowing the small agencies. That's another big thing. There is a lot of unknowns. Again, I love Berlin VNA. It's providing very special care, and you can ask some of your residents that were served by them. There is a big difference. Now, again, when it comes to dollars and cents, I cannot answer that. And I know, you know, it's been, I talked to these nice folks, and they've been trying really hard. You know, what future will show, I cannot predict. But again, the market is changing. The market is going through a lot of changes when it comes to organization, reimbursement, and marketing. I'm in medicine. I'm not in
The business side.
in the
Sure.
visiting nurse, and even myself, who is in medicine, is having a hard time
I read all of that.
catching
I
up
agree.
with some of this stuff that's been recently changing.
It's difficult, healthcare in general. I think we all have, if we paid attention to anything in our country over the last 10 to 20 years, healthcare is very difficult. We understand. So, and again, nobody's blaming. It's just not the blame to anybody. It's just at some point when you look at a problem, when I look at a problem since 2015 and I go back, it's been a problem since 2011. It's never been remedied even, and I don't even mean we have to, even if we broke even, if we lost $100 grand, you know, we're not like penny pinching that way, but to lose $935,000, that's, you know, that's significant to our budget in Berlin. No town department, you know, has probably had a loss of that size, or 700,000, or even less than that. And so we have to, we're trying to treat everybody. I mean, I guess I read some things, and again, I wish the whole staff would meet with us, and that's part of, I guess, maybe the communication problem. I find it ironic that I've seen in public, they've talked about, well, no one talks to us, and I offer to talk to them, the entire staff, and they don't want to talk to me. And if they don't want to talk to me, I get it, you know, maybe we'll talk to somebody else. Maybe it's just a Roche, whatever, but, you know, as the elected official here, and the council represents the voters of Berlin, I find that a little disturbing, quite frankly, to me personally. Just that the town staff doesn't want to meet with the council member, but to explain things and to hear their side of it. I mean, we're anxious to hear that. If they're that upset and afraid, which I've heard and read in social media, then let's talk about it. Let's fix it. We're here to fix it, not to end it. I find it very difficult, very strange that the argument has completely been turned around to not what we're looking to do at all. But we can't just look at this and let it go. I mean, so I guess every town department that's losing $1 million a year, or, you know, we just don't worry about it. We can't do that. I mean, that's not what we're elected to do.
No, I think it needs attention, of
Yes.
course, and it needs support.
But
And
we've been
under-
asking for attention
so-
since 2015,
Yeah,
and
I
I
can't-
still
again,
don't
I
get it. No,
can't
you haven't
speak-
been here.
I can't speak to the
But that's why you have
history
to
of it.
understand our
Yeah.
frustration that have been on the
Absol-
council for years now. We just want some type of solution from you folks. I mean, you're the experts more than we are.
So
we're the
I think,
lay
again, we
people
can
talking out.
agree that
Yes,
there's a
yes.
history.
Yes,
But
not a
we
good
all,
one.
right,
Not a good
well, we don't want to, not a good one financially.
Financially, that's
So
what I mean,
let's-
not service-wise,
this-
please, don't
so-
mix apples and oranges.
Right,
here.
but I
Let's
just
not
want to
mix
be,
that.
I want to be,
Yeah.
you know, make sure it's clear. And so I think it's important that communication has to flow both ways. It can't just be one, you know, piece. I mean, if it's concern, again, I don't know operationally, I know meetings are open, but like I had said to you, Mark, when I met with you, I didn't pay attention to the charter. I've been a Berlin resident my entire life.
Right.
Do you think I was involved in politics? No, not until I saw the call that the VNA needed membership and board members, and I felt it was a calling for me to do. I switched jobs, and I was like, this is something that I can contribute to based on my expertise and my knowledge. And so that was my call. Up until that point, I bet you other people in this room, are you paying attention to it? Unless it impacts you? Probably not. And I think that's why you're hearing a lot of chatter about it, because it's impacting people now versus, you know, maybe in years past, they weren't paying attention to it. I don't know. I can't speak to that,
Well,
but
I guess-
this is why I'm just saying,
Yeah.
there's communication problems both ways. And so what we can do moving forward is obviously have a greater transparency. Like I said, I've known certain members of the town council for many years, and they had no idea I was even the chair of the VNA board. So I think it can go both ways in terms of approaching the VNA. It's a problem. It's on your radar. Come to a meeting.
Future, because he's just like
The,
us.
the same goes for coming to their open meetings as well. So.
That's why we're here tonight.
Right, exactly. But I think that that's partly where the I think questions and doubt come in. On the other, I'm speaking on behalf of the group,
Yeah.
is
The group-
we're
which-
now
which-
2
which-
weeks.
Which group?
This group here, the
Oh,
VNA
yes.
board, and anyone who's speaking out in opposition of the charter change or not,
Right.
you're 2 weeks from the vote.
Yeah.
Meetings like this probably should have happened
Well,
over the
votes-
month,
the
over the
votes-
past months.
The
That's
vote's gonna be what the vote's gonna be.
Exactly,
and that-
right.
and that- It is what it is, but we still have to fix
to,
it.
and
no
we still
matter-
have to work
no matter
together
what
to
the
move
vote.
towards a common goal. And I think that's the important
Yeah.
message to get across, is how we're going to achieve that either way.
Agreed.
So I think we got off track.
Yeah,
And
Yeah,
I'd
we're
like
off
to
track a
get
little bit.
back to that original question of
Yes.
exactly how the ordinance
Yep.
makes it
There-
easier
Well, I'm
to
gonna
manage.
we're not doing that right away. That's just gives us an option. That's all that charter
So,
question does.
Can I
It
ask
gives
a
us an
question
option.
about that, Mark? Because, so you're expecting the staff to work in an unknown for an undetermined amount of time, just waiting for the ordinance to come.
What is the ordinance? How is the ordinance?
Because
comes
we
or
don't
not
know what
affects
it
us?
means.
Well, we don't
Because there
either.
isn't, but that's a
We don't have
problem.
an ordinance.
But you're asking the voters to vote on something that doesn't even exist.
We're asking the voters to give us an option.
But why do we need that right now if that's not something we're gonna do right now? Why would you spend all the time and the money to open the charter
I'm gonna
to
let,
have that as like a back pocket
yeah.
thing? Like, why would we do
change
that?
language in the charter all the time, so we can fix things and do things. One of the questions there.
But now the staff have to work under this dark cloud of possibility of,
Give you a little history.
Yeah, that's right. He's on council
Yeah.
longer than me, so he's got more history than that.
insane
Yes, please,
expectation of
please.
staff.
This is all good. This is great. We gotta talk about it. Those good stuff.
My name's
No,
Todd
this
Vanessa. I'm
is-
on the council of the mayor. I've been there for about 10 years, and I've been a big fan of the VNA from day one. When my mom needed help, they were phenomenal. I cannot say enough good things about the Berlin VNA. And I see what's going on with healthcare with the giant corporations taking everything over. And every time I get near Trinity Healthcare, Hartford Hospital, I'm completely disappointed because there's such a gigantic obstacle to deal with as a patient. I know nothing about healthcare. I work with dirt for a living, so I depend on you experts. But I do know a little bit about the history, and what scared me was every couple of years or every year, somebody from the finance board or somebody from the council says, let's cut the funding for the VNA. We can't afford this. Yeah, will make
Talked about how his
you're limited to a certain, say they cut you to only a $200,000 subsidy, you'd have to lay people off. I don't want that to happen. But there's no mechanism in the charter for the council or anyone else to adjust anything. If the VNA board came to the town tomorrow and said, we have a plan to do A, B, and C, our hands are tied. It's in the charter, and that takes a couple of years if you're lucky to change it. So when I was asked to work on a charter review commission, we were very careful with the wording. We had the town attorney who's an expert, and we hired a separate attorney that specializes in charter language. And the way it was written was the mandate in the charter would only sunset, and that's where the big panic came from, if and when there was an ordinance to replace it with equal or better health care. So the Herald, day one, lied. They said, we're out to kill the VNA. The big headline, I was appalled at the way the Britain Herald lied to the public. That wasn't the intent, that wasn't the language. The language clearly states something will only change if and when there's an ordinance to replace it. And to make an ordinance, there has to be public hearings, there has to be support from the majority of the council. The way our council's set up, no one party can railroad it. It's not a political thing. But the only control valve the town has at all is to cut the funding. And that's not to me, that's not a viable option. I don't want to say we're going to mandate a smaller budget and you have to lay people off. But and nobody has the answer yet, but if the VNA came to us with a plan, we can't enact it. But this way, the council could create an ordinance that worked and helped the VNA.
Charlie, aren't there state statutes in place that limit the amount of money that can be statutorily cut to the VNA?
No,
Yes, there are.
there's no
Yes,
statute.
there are.
There's no statute. There's no state statute. It's not mandated funding.
Really? Department of Public Health, there's no statutes that govern
Because
that?
we have to provide health care. It doesn't get into detail how much it should cost us. And the other problem we get into, I understand the increased revenue. You have the staff, you want to work in other towns. If you're spending $1.50 to bring in $1 in another town, are our taxpayers actually subsidizing other tax towns? You follow me?
Those
I'm
are
not
fixed
an expert.
costs, Charlie. That's completely wrong. That's a
If you
fixed,
want-
you
yeah,
discussed this in
probably
Board of
that's not-
Finance.
Let me
Charlie.
talk for a minute,
Yeah.
okay?
Yeah.
Yeah, but, yeah, hang on a second. So it's a meeting if,
Yeah.
let the speaker speak, and then I'm sure the chair will recognize someone in the audience or on Zoom that could speak. It's not, we're not trying to debate here, we're just trying to have a.
I'm trying to explain
Yeah.
how they got to where we are and the nuts and bolts of it. And as I said on the council, you folks are intelligent. Read what was written. Don't take what somebody tells you. Read it for yourself and understand what you're voting
I read
for.
I've read it.
And
I
and it
still
doesn't
don't,
sunset until there's an ordinance in place that replaces it.
Yeah, and I think that it's the unknown, like anything. Again, having nebulous out there, people want concrete, you
And
know.
next year, there
so
could
I
be
think-
another charter revision commission and eliminate it. That's another danger. I mean, it's all unknown. We don't know what tomorrow's gonna bring. But I'm doing everything I can to keep the VNA active. And if it became an ordinance, the folks in Berlin may say, it's worth $1 million a year for us to have the VNA. We pay for our police department, we pay for our firemen. Maybe it's worth that for that kind of personal health care. But that should be up to the voters in the budget, not mandated by the charter, is my feeling.
So that's the key difference. What you just, again, that was like the original question, like the difference between the ordinance and the charter.
The ordinance would
is-
allow change by the council. Or if it's in the charter, it's locked in, and the
Okay.
only thing the town can do is cut the funding.
Well,
Am I correct? So you're on the board of finance.
The only thing the entity itself exists by charter, right? Just by charter. So the entity is there. The entity is not going anywhere. But that doesn't mean staffing or operation of the town to do what we have to do to try and fix it, right? And that's the goal, is to have the town, if it's left
So
in
I
the
think that's
charter-
where I'm confused. I'm
Yeah.
gonna be honest with you. Again, I'm not a town, employment expert. That's where I think I'm confused, is understanding the difference between the restriction in the charter from operations of the VNA and the ordinance of operation. So what changes in how it's operated in order to achieve financial outcomes, aside from the budget and cutting it in the two difference? That's what I personally am not.
No one has the answer on how to make it better. But when it's locked into the charter like that, it is what it is. And the only way to control the spending is cut the money available. If there was an ordinance, we could be more creative. And we need the VNA board, we need doctor support, we need people. We had a member of the council that was in nursing and she was going to work with the VNA. I think she joined the board.
Yeah.
And she was gonna help us, and she threw her hands up, said, I don't know what to do. And I don't have that kind of background. I'm dependent on you folks to help us. But if you walked in tomorrow with a creative answer that said, this is gonna work, we couldn't move on it. It would take another charter revision. It would take a big commotion. This way, the council could listen to both sides and say, yeah, it's a good idea or it isn't. Or we could even put out the referendum at that point. It gives us options.
So
way
it
is
gives the
now.
council control? Is that what you're saying?
That's exactly
Gives,
right.
like, Council control,
To create
over
an ordinance,
decisions?
correct.
but
That's
if it
exactly right.
becomes an ordinance, it gives the town council control over how that VNA runs.
Yes.
Thank
It would be operated by ordinance, correct, which ordinances are created by the town council. But there again, there's public hearings, there's public input, and people get voted in and out of office by displeasing the public. So it's more voter driven than the way it is now.
But it also leaves the VNA very vulnerable to whatever the council at that time decides. Maybe they
absolutely.
decide to get rid of it.
And it's all, well.
So it puts it
I
in a
don't
very
think we can
fragile
by
spot.
statute. I think we have to provide it. We'd have to find another alternative to eliminate it. Legally, I think we
If,
can't just
if
stop
it's out of
treating
the
patients.
charter, you can't just decide
I
and
don't
go through
think-
that
I don't
process to
think the
close
state
it.
would allow that. I don't think we-
Well, you'd have to go through a process to close it, but
We'd have to get another.
they could
provider.
just decide that we don't want to do this anymore.
But the other option is if the Board of Finance or the voters feel that $1 million loss is unacceptable, we can cut
But if the
that.
voters vote no, then they're obviously in favor of the VNA and they want us to continue. So
I don't know anyone
it's
that's not in
voted-
favor of the VNA.
if it's voted no and we're removed from our protection and requirement in the
But
charter,
charter doesn't
but-
give protection. It locks you into the town is handcuffed. The only thing it can do,
which gives
It's
us
cut
protection.
is they can cut your funding.
Can you give another example,
But it-
Charlie, excuse me, Leah, give another example of what else is in the charter? I don't know, Sal, if you, like, so that you can compare it, like compare another town item, line item that is in the charter that you could cut the same way. I don't know if I'm making myself clear. I'm just trying to make it,
Fire
Karen, may I
protection
address
is
that
Fire
provided
protection,
by
okay.
volunteers, okay?
okay,
We could give them less money every year and they would operate less.
okay.
Nursing is in the charter. We could give them less
Even
money.
from
every
a,
year.
from a budget standpoint, we can cut budgets, based on some justification on any department.
Right,
if you think
Okay,
about it,
right,
okay?
exactly,
You know,
yeah.
I'm the Board of Finance Chairman, and part of it has been driven by the Board of Finance, okay? Because we looked at the continued losses,
Mhm.
okay? And as you mentioned, there's been changes in leadership
Oh.
throughout several years,
Yep.
okay? And we've gotten a lot of promises made, we're gonna get better, we're gonna change these things, the metrics are gonna change, and we haven't gotten them. So there's been a frustration level on the Board of Finance standpoint, say, hasn't gotten better, it's gotten worse, okay? And then we understand the billing changes that have reduced some of your revenue. We understand the goal was, when we were talking to some of the directors, was we maintain care on that patient longer, which was the wrong thing to do.
Yes, it is,
Because you were losing money
Mhm.
on maintaining care on that patient. But that we were being told the census was going up and we're maintaining care, and in effect, we're losing money because you were extending the care on that patient for too long of a time.
Mhm.
So this has been a culmination of things that have been promised to us, and the efficiencies haven't been put in place. We asked for a marketing plan. How are you going to grow the revenue? Could you give us a marketing plan? I mean, it's a tough environment. You are dealing with Hartford Healthcare. My mom is 90 years old. She had a hip surgery in Hartford. okay? The first thing that comes up once she comes out of operation and post-operation, you got
Home
Hartford
care.
Healthcare people right there. And you were great for her, you know what I mean? But I wish the Berlin VNA person was there rather than a Hartford Healthcare person.
So that's a discharge
Okay.
planner, though. We don't have any rights to be even
I
in the
understand that.
hospital.
I
And
understand that.
legally, they are required to give a list, and they are not doing
I
that.
understand that, but my point is that, you know, the big picture too, is you see that it's hard to compete with this mega health company. And I understand the great care that, you know, our people do for the town of Berlin. But we haven't gotten the results, at least a little better results from a Board of Finance. So as a Board of Finance chair and a Board of Finance group, we're trying to keep a balance between good quality care and protecting taxpayer dollars.
Yes.
Okay? And to me, we haven't done a good enough job on the financial part of it. Okay? And some of the metrics, personally, I haven't seen any great metrics that tell me how the study was done, right? Show me how, you know, what metrics they told you to put in place, and then how well we doing against those. I don't, we asked for that. I don't even know if those, you know, are you maintaining those metrics from that study? And then show me how you're doing against those metrics. You know,
Yeah.
What are your goals? We don't see any of that, okay? So as a Board of Finance, we have to, you know, keep that balance and make sure that we're protecting taxpayer money also. And in respect to ordinance versus charter, say, for example, I don't know, maybe you wanted to outsource part of your services to make it more efficient, whatever. We can't do much from a business structure standpoint with the way it's in the charter right now. So an ordinance would allow us to maybe make a business structure change that would allow you guys to be more efficient. That's the difference that I see. I don't, you know, we don't know what you guys can do to do something different. You're the experts, okay? But ordinance would allow us, you know, to say, you can open it up a little. You're not really structured. You're not really restricted to just the words in the charter. Because if you look at the words in the charter says you only provide services for the town of Berlin. So as a Board of Finance guy, I'm saying, we're losing all this money. Don't provide service, you know, thinking, you know, narrowly, don't provide services to 8 or 9 other towns you're providing services to. Just stick to Berlin. But I don't have enough information to tell me. I know you shook your head when somebody said, well, we can take away other towns. I like to hear your opinion because, you know, this is our opinion based on what we've been given to date. You know?
So just, you know, from my assessment of what feels like forever, but short time that I've been here, is just a lot of mismanagement from the administration of the VNA, for sure. I can blatantly see that when I'm looking through things. I can see that. I know that there's been issues with communication, but I think it goes far beyond the administrator's seat. And, you know, I've heard everybody speak about, well, for 7 years, we knew about this, but why didn't you hold them accountable? Why didn't somebody, I want the answers today, you know, why didn't we hold those people accountable? And now it's like we are
They kept leaving.
kind of like punishing the
For
staff
one
in a
reason,
sense for the problems that weren't theirs.
They
And
felt- They felt they were bulletproof because the charter mandated they get subsidized.
well,
I can answer that question though. You know, in the time that we said we're trying to hold you accountable, all right, we didn't get the information and then the next person was in charge. Okay, so how do you keep anybody accountable?
so I can understand
How could you
that
keep
point.
anybody accountable when?
You don't,
It's
right,
a-
you don't have,
it's a
it's a
turnover.
revolving door, yeah.
Yeah.
Can I
So
add
I can
something?
understand that.
It's a little tangent here, but since you mentioned that, I think I just would like to add something. You know, you mentioned something about your mother, I believe, that was discharged and she did not have options given to her. And that's illegal. That's illegal according to the state of Connecticut. And actually, that's what really is hurting the institution like Berlin VNA. If somebody could report it to the state of Connecticut that that Hartford Healthcare is breaking the law.
I
That
believe
would
Trinity
probably
tried to
help,
do that.
help institutions like this tremendously, because I believe there is a state law where upon discharge,
There's a choice, it's patient choice,
administration
yeah.
has to provide 3 choices.
Mhm.
And
Yes, that's
they
correct.
don't, and they blatantly break the law.
And-
So we cannot do this because we are not somebody who can do that, but somebody who is using the services, I believe has the right and duty to report this because this is really harming everybody except Hartford.
Mhm.
Yeah, I mean, I agree with that. I mean, you don't really, in that kind of situation, you don't really have much time to react, once,
Yeah, but you can do it now.
I know.
It's
I can do-
education
I
of the
can do it now.
consumer.
Yeah,
Yes, there's a lot, yes.
You can do it now. I
So-
think there is a state institution you
I
can
mean-
report it to, and
Isn't it on that? I mean, my parents used the VNA too, in Berlin, here, but I don't know. I think there was, well, at least when they were discharged at some point, there was a piece of paper that had options, right? I think there was a piece of.
They're
paper that
supposed
they
to be,
wanted,
yeah,
right?
yeah.
Supposed to
Yeah, I
be.
do remember that. That's in the past now. That's the what, that's before Hartford Healthcare bought everybody.
right.
But there was options offered by
That's
the social worker. at
right. The
hospital,
social worker was
Yes,
mandated to
Yeah.
provide
Yeah, I remember that.
three different options. And as far as I know, I left the hospital a couple years ago. That was changed when the computer system was changed to a new system. And there's only one option, and it's actually automatically fills in.
Of
To
course.
change that option,
Of course it does, yeah.
I know how it is right now.
Yeah, I mean, we get that. I mean, that's, it's.
But that would really help, I think, Berlin VNA if some people who are using those services would report it.
Mm.
So state can look into why is that so.
I mean, my mom lives in Berlin, so I would prefer that the VNA take care of my mom.
We would
And
love
Hartford
to.
Healthcare.
We can look up into some
I'm serious.
state agency that's supposed to look at it, and you should report it.
So just to
That was
speak
just a
to,
What piece of the
thank you, thank you, Dr. Drzefka. But just to speak to that, I mean, the VNA board, and no offense to anybody here, thank you for being here today, but has not always been, I think, at the level that it should be. We have some really great active people on it now, and I can feel that support. I would love to have all members present. It was a little discouraging to go to my first board of directors meeting to find maybe 5 people there. So that was concerning to me. And then hearing that, staff shared concerns, nothing was done. You guys didn't get the answers, and it sounds like maybe it wasn't a fault of you guys because there was change in leadership, but it just is concerning to staff that they feel like they're going to be in an unknown with this ordinance just kind of back here. And you have to understand that that's real. Nobody wants to go to work waiting to, have a change come. It's going to be very stressful. And I don't think that's really acceptable to expect staff to just go. I know you keep saying, we're not going to do it right now. It's just maybe, but that's an unknown. And going and working in that unknown for an undetermined amount of time. We've been in chronic stress since the beginning of this charter review. We are all feeling the mental and physical effects of working in this chronic stress state. And I just don't think it's realistic to expect staff to continue with this
If you're a
feeling.
private company, you'd be under the stress that someone else could walk
Well,
in
we're
and
not,
buy your
so-
company any day.
We're not.
So there's no guarantee in this world.
I understand that, but right now they vehemently oppose the ordinance.
And everybody's entitled to their opinion, and I appreciate their input. I was just trying to explain how we got to where we are.
No, and I think it's been, from my standpoint, it's been helpful to hear, historically, what you didn't get.
But we're not
I still
historic
don't-
now. I
no.
guess we're not historic now. We're a week ago when I offered, because I want to hear their concerns.
Yep.
You're expressing, you did to me on the phone. a
Yeah, and
couple
I
times,
understand they
that's good to hear.
They feel like it's a
But-
day late and a dollar short, and they know what you're gonna say, and it's kind of like
How
too
do they
late
know
to
what
have
I'm
this
gonna say?
discussion.
Are they gonna-
Because we've heard what you said at council meetings. We
I
know
don't
where
think-
you
I don't
stand
think
on
you have
this.
if what is being put out is not what was said at council meetings, and that's by town employees on social media, and it's by other folks. So obviously they don't want to hear what was said at council meetings because that's
Well,
not
that-
what they're putting out. But I
They
mean,
have their own perception of what
They
was
know
said.
the
How about
newspaper
that?
just reported it. They won't.
Just one other thought to you guys. I mean, there's more flexibility if you go to an ordinance, believe me, okay? Because it does allow, once you guys get a handle on, your business and your structure and all that stuff, okay? There's more flexibility that allows us to say, maybe we want to do something different. The ordinance will allow us to open that up and say, maybe, you know, we can do something different with the structure of the business. With the way it's set today, it's worse, because the Board of Finance can say, well, we can't sustain this $1 million of loss anymore. We're going to tell the town manager, we cut it down by $500,000. You figure it out how you want to do it. And that would be disaster. That would be disaster.
But is that the plan though? Like, is that the plan?
Hear me out. I'm just
Or are you
telling
gonna give me
No,
time
but-
to
no, but
try
I'm just
what we're
tell-
working
I'm
on?
just telling you the ordinance provides for more flexibility. That's all I'm telling
This
you.
is what
Then
we
why
asked.
wouldn't we want to
asked
go
that.
to that immediately? If it's better
Because
option,
we
why
gotta
wouldn't we
want
want
to
to?
talk to you and
It-
work through the business structure with you.
Hold on, Peter.
And
Okay.
look at it, and how do we come up with an ordinance that makes sense for the business?
Okay,
Peter did want to share, and then we have
Yeah,
a couple of questions
so-
I want to read
So
out.
I mean, I appreciate your guys' attempt to come in at the 11th hour and try to persuade people, but I just have a couple questions. So you're
This has nothing to
saying,
do with the vote, so.
you're saying, excuse me, I'm speaking. You're saying that if a no vote goes through and you're stuck in the charter, that you're going to cut the budget, right?
I didn't say that.
So what has stopped you from doing that for the past 7 years, since it's already been, since that's something you can already do?
Because for the past, since I've been Board of Finance Chairman, we've been talking about opening up the charter for the VNA, since I've been Board of Finance Chair because of the losses. So nothing's changed from a Board of Finance standpoint. We've been shooting for, we've been getting legal advice from the attorneys. We've been saying, how do we make changes with the VNA? And the best way to do it is open up the charter and actually at that point, change the words in the charter as opposed to going to ordinance. But once you change the charter.
But what you're saying is that you'll be forced to do cuts if it doesn't pass. Well, in its current state, it hasn't passed. So how are you able to do cuts if it doesn't pass, but you can't do cuts now?
I guess, Peter, to answer your question, I mean, it's a simple answer. We haven't wanted to do that because we don't want to do that to the VNA. Yes, we could have cut the budget $1 million last year or the year before, 2 years before that. We don't want to do that. We could have done that. That's if we wanted to have done that. It's basically the same people on the council have been there, most of us, for several years. Yes, we could have done that. That's not the goal, or we would have done that already. I guess that's what's so frustrating. If we wanted to get rid of the VNA, we would have cut their budget 5 years ago. We did not touch it. We let it run out of luck. We're trying to find a solution to keep it viable and great for the people of Berlin.
And here's the reality. The only thing stopping you from cutting it is the charter.
So, I mean, we could have done these things. We didn't do it. If our goal was to eliminate it, we would have done it a long time ago. We would have cut the budget. That's not what we're looking to do.
But you can't do that with the way the charter is.
Yes,
And that's
we
why you
can.
haven't done it.
Yes, we can.
okay,
As
so
long as- let me just explain it to you. There's a state statute that does control it because we have the VNA providing services. There's certain services we have to provide. But it doesn't say we have to fund it fully. And I mean, it's a legal argument about different things, which we could be here all night talking about it. But the point is, if we wanted to do it, we would have done it if that was our goal, to eliminate it. That's not our goal. And I know no one wants to hear that. I don't understand it. We would have done that a long time ago. We didn't do it. That's not what we're trying to accomplish here. But you hear what you want to hear, and that's okay. The vote goes the way it goes. It is what it is. We get, hey, the voters will speak, and that's fine by anybody,
Yeah,
right?
can
That's
we
okay.
address some of there's, I think,
Sure.
up at the top, is there
yeah.
just a comment? I can't see.
And I have one thing that I just wanted to add, like, I'm here now when we're talking about future. We talked about the past. We can't change anything about that. We're talking about the future. I am fully transparent. I'm willing to work with everybody. I would love the expertise of the Board of Finance. I'm not a finance person. I'm a nurse. I know medical, I can do the budget,
And
but
vice versa.
I would like input. I want a strong Board of Directors to be behind me, to support me and be my resource. I want, the town manager to be involved. He always asks great questions every time we're meeting to better understand. And from my point of view, in the administrator seat, I can see the changes that we can make as we are right now to be better. Kara can see the changes. So I don't really see the point of this shift. We can contract things out. We have a lot of flexibility right now. And I do have a concern from the staff that in the last Board of Finance meeting, there was what felt like kind of retaliation. Well, if they get no, we're just gonna cut their budget. Like, well, that's nice. Like, work with us.
That's
Work with
disturbing.
us.
That's the only option that they're pushed to, with it being in the charter.
So we can't give a marketing plan and give the data
We
for a
could,
while
but for
and
the last
work
7 years,
together
nobody's
as
done
a
it.
team. But if that's what I'm asking for, we can't do that. Like,
All
we
I can-
have to just
all I can
either
say
go
is
to
that
ordinance
E-
or
either
we're cutting
way,
the
I hope it
budget.
happens. We need to work together to
We
save
do
it.
need to work
Mhm.
No
together.
matter which way the vote goes
Absolutely. This
together,
is
we need to work
multifactorial.
together to save it.
We agree, we're all for that. But we have heard that for 7 years. You gotta understand. We
Well, I'm
you-
different.
You could, I know you're new.
I'm sorry
and you
to
could
say
you
it, but-
forget the- You could say you forget the history, but we can't because we've lived the history.
Well, I'm not saying forget it.
Well, but I mean, we've asked
But I'm
that.
saying looking forward,
Well, we
you
want to
know.
look forward, we want to be positive. and we
I
wanna
want
work
people
with
to
you.
come into our office. I want people to
Right.
come through the door. Nobody's come through
Well,
the
I
door.
don't-
Nobody's come down to
well,
us.
Again, from a week ago, don't tell me it's a daylight dollar short. If you want to talk.
Have a good night, everybody.
That point, I would hope you would talk to us, but
Well.
we'll go forward from that. We'll let that go. But the point is, we've waited 7 years from every director we've heard from. They told us the same thing you did. I mean, I'm not slighting you. It's not your fault. It's nobody's fault. It's just we've been sitting patiently waiting, seeing the losses go up, not even down.
Well, it went down. It did go down this
I
past.
think we
Up
can't,
and
you
down,
know,
but,
as
yeah,
Doctor
that's all.
said,
That's
you,
all.
you have to
Yeah.
throw in a global pandemic.
I get that.
And
And a
We get that.
change in reimbursement,
We'll give you the
significant change in
935.
reimbursement.
No, you don't even have to give that much, but
Yeah.
that would account for a sizable deficit because of the expectations that were put on healthcare and the strain. So you have to kind of,
Okay, so I just wanted to read some of these.
Yeah, no, I get it.
If it becomes an ordinance, can the town council subcontract or outsource the VNA?
Well, you say you can subcontract it anyway, right? It's the-
Well, I'm not saying everything, but I'm just saying we do contract some
Therapy or
therapy
different-
staff and
therapy
things
staff,
like
yeah.
that. But they're asking, can you subcontract or outsource the entire VNA?
I don't know if that's what we would do. Or if
No,
we
it all
could do
depends
it.
on how.
but
they
you
work.
could,
Yeah.
you could, it's a possibility,
It's a-
right?
It's a possibility.
But it's not what you're
So
leaning
they're
towards. It's not the plan.
Don't forget, you're gonna create the ordinance in effect. You're gonna,
Mhm.
you know, so you have flexibility in how you want to create.
And
Create
it's
the
by-
ordinance.
And it's
Okay.
by, remember, please, folks, everything we're doing, we aren't voted in. And we answer to the voters, to all the voters, every voter in town we answer to. That's the way I look at it. That's the way it works. And whatever changes we would make, the charter, that's one change we're proposing, right? Voters voted down, it's over. Okay, we move on. If they did change it, if we did do an ordinance, we've got probably 2 or 3 public hearings we have to go through with the public to come and tell us what they want, what they don't want. So it's always out in the public. That's how we operate. That's how we operate the council. That's the way it's supposed to be operated. It's all transparent. It's out there. So, yeah, we always are gonna let the voters have their say, and they'll have it November 8th, and that's great. I mean, it is what it is. It's okay. I just don't like when the message gets twisted on social media, which is, we live and die by social media now, let's face it, that's how it goes. It's very hard to get folks the correct information, and it's very frustrating when things are very well intentioned by everybody involved in the process. Again, you know, everybody on the council, the entire council voted to do it. The entire Charter Review Commission voted to do it. Again, both parties are involved in that bipartisan decision. We thought it was a good idea. Well-intentioned. That's all I can tell you. It's a well-intentioned thought. It is what it is. You know, we could beat it to death, which we aren't, but we can beat it to death, but we're trying to fix it, not eliminate it.
Yes,
That's all I can say. Yes, next time.
If I could just add, if and when the ordinance was proposed, I would look for the VNA board to create most of it, because no one's gonna know better what they need to operate it correctly. The council's not experts like the nurses are. We would need that input. And the beauty of the ordinance, if we tried it for 2 years and that wasn't working out, they could come back and change it. If it's locked into the charter, you're stuck with it.
you.
Somebody wrote without successorship in the current contract that leaves open renegotiating jobs and hourly wages, especially if employees will have to reapply for their jobs. I guess if there was a switch to ordinance, is there a shift in, are they still union members? Are they still town employees? Do benefits change or salary change?
That doesn't change any of that.
Okay.
No, that's it.
That's a good question for somebody.
Concerned citizen, at the end of the day, the elderly, seniors, and the ill who deserve quality services are in jeopardy.
Anyone else have other thoughts? We've got staff question.
So we're all school nurses.
Mm,
And
mhm.
under the charter,
Thank you,
VNA oversees the school health program. So this goes through and there's an ordinance. Where does that leave the school nurses and aides?
Mhm. Thank you, Jen.
I mean, it could not change anything. You could stay. I mean, I don't think we're looking to necessarily, that's not something we're looking to do. I mean, I don't think we've ever discussed that part of it, just kind of, the entity would stay the same. It would just be governed by an ordinance, not by the charter. That's really that's the difference.
We
Well,
never
when we-
know that would go under board of
When
ed.
we
Well,
talk-
that's always a possibility. I mean, you wouldn't change where the budget money goes to.
When
Go ahead.
when we look at, the losses and so forth, the school nurses are not part of that.
It's a different budget.
Okay,
yeah.
so when we talk about VNA, the revenue and the loss, it really excludes the school nurses because you're part of the school. Nothing will really change with respect to that.
Well, there is a concern of school staff because if they did go under Board of Ed, there is a significant change in benefits. And they would have to reapply and it's kind of a whole new thing. So they are very concerned about that.
Or what you could do.
Versus town versus Board of Ed.
Switch unions or something.
Well, I don't know where they would
Benefits.
fall,
Oh,
but the benefits are different under
Yeah,
Board of Ed
so
than they are
that's-
under
I
town.
got you.
I
Well-
think you could stay under the same union. It
Okay.
would just be renegotiating under a new employer. So
Gotcha.
it would be
But we
Board of
weren't
Ed
sure if they would
versus
have to all
town.
reapply, if it would be all brand new,
mean,
if they
and
would
then
keep all
sharing
the
of
staff, what is the
resources.
salary? I mean, they're kind of
What
up
the
in the
Board of
air
Ed
and
would do,
they're,
What the Board of Ed would do if they
Yes.
got there, yeah. I mean,
so they're very
understand that.
concerned about that.
Well, we get that, but that's not, we really haven't even thought about doing that because I think like Sal said, that's not kind of the issue with the VNA. You're not a revenue loss. It's kind of different part of the VNA, right? It's just a different,
But I think
in
there's some
sense-
support from the school nurses do provide,
yeah.
correct me if I'm wrong, or they used to provide some support to the VNA when needed, correct? Not as much anymore.
They
I have
were
heard that.
asked to do that when there were significant staffing shortages, but I have not, some people volunteer on occasion, but it's no longer an enforced
Not
Okay.
mandatory.
union
Okay.
contract
Okay,
line.
okay, yeah.
It's
There's
in
a
their
sig-
contract, but I have not been enforcing that.
Yeah. And again,
There's just a lot of what ifs.
I-
The staff is just worried about all the what
No,
ifs
And I understand. that.
and the lack of
believe me.
clarity.
No, I get it. We understand it 100%, and that's why talking like this, I think, was important to hear that. We get that, but I don't think any of us have, even in our minds, if I haven't, I don't know, if any of us have gotten that far. We're just trying to kind of look at the immediate issue and move forward and see what we can do better. That's really what we want. And but again, like I said, it's hard to dismiss what we've been through and again, not.
I agree.
Not on you.
Because the staff went through it too,
Well,
so
the
I
staff has
agree.
gone through it. I know
I
they have. They're the
agree.
ones gone through it more than we are. Of
Yeah.
course, they've worked there, but, we've had past directors tell us the same thing and nothing happens. And, town managers have worked on it, tried to help, and I know Roche is also, very much involved and working for a good solution. And he hasn't been here that long either, so we get that. We get it's a new crew, so to speak.
Yeah.
To get it together, and we're hopeful we will. So
So-
hopeful, whatever happens with the vote, we got to work on it, and we'll get there.
Yeah, and we all are on that same page.
But in the next 6 months or the next year, if things improve even marginally, I can't see the council looking for any kind of one. They look to leave it alone,
That's the way it's written.
the way
We
it's
don't have
written.
to do it.
We don't have to do it. The only time it would come out of the charter, if everybody had an ordinance that they thought would be better than what the charter provided.
Mhm.
So there's no plan to change anything until somebody comes up with a better idea. And so
Well-
far, nobody's got that idea, but we need to work together, whether the vote passes or not, no matter what happens.
Absolutely,
We
because
gotta
there's
work
still a lot of
together to
work to be
fix
done.
Yeah, no, there
Yeah.
is. But and so I just want to say, moving forward, we want to have a more
Transparent,
yeah,
collaborative. It's
yes,
collaboration.
Collaborative
It's
approach.
collaboration. It's,
But I
Yeah.
also
This
think,
was good.
Absolutely.
This was not bad, this was good.
no,
I
it's
still
good
have more-
dialogue.
Huh?
You have
I still
another
have
question
more,
and then
yes.
before,
No, it's okay.
yeah.
It's good.
So
It's good.
I just feel like also I have not been given, and I mean, Arosha, you have mentioned some figures in our private meetings, but I'm looking for, what is the goal? What is the expectation?
From an operating
Because if
loss
we don't know what that is, I don't know what we're working towards,
Goal, I can tell you the goal real simple, that loss, you gotta keep cutting that down.
But like, okay, so for
Yes.
the next
What is that?
year,
Yeah. like
what
is
are
it?
we shooting for? The next 2 years, what are we
Well,
shooting for?
you
The
know,
next 5 years, what are we shooting for? Like, we need goals.
We we've kind of given goals the last couple of years that haven't been achieved, you know what I'm saying?
Yes.
Have you seen them?
I mean, so, no,
Right.
the budget that we provide, right, says you're gonna hit this loss in effect. right?
Yes.
Right,
So-
okay.
Because the way that Kevin Delaney had explained it to me is that it's like budgeted at a loss.
It's a budgeted loss.
So we've been meeting the budget, but it's been at a loss. So what's the goal? What's the expectation? I know that it's to reduce it, but can we make a number? Can we have an actual
So you're-
figure
you're
to work
meeting-
towards?
you're-
Well, I mean, the
You
thing
know?
is that before I can do it, before the Board of Finance can do that, we need to understand how you're gonna get to a better position too. You know what I'm saying?
Yeah.
I mean, how do I tell you I want to cut it in half, right? Without me understanding.
Well,
what
give me
your
the
plans
goal
are.
and I can
What
tell
your plans
you,
are.
I
I
can
mean,
give you a
frankly,
plan and see if it's achievable.
frankly, Maybe a couple of years, then, a couple of years, 3 years down the road,
Mhm.
we'd like to see it close to maybe a couple $100,000 loss, close as to break
Yeah.
even as possible.
Of course.
We can get there, but we wouldn't say you gotta get the break even tomorrow, you know?
Well, and that's where I'm
what I'm
coming
saying?
from, because the comment of, cutting the budget, we could just cut the budget, we could cut, okay, but where are you willing to work with me? And what kind of time do we have, before you're gonna just do that?
No, with the whole thing, Leah, no, please don't take it that way.
That's
No,
how it
yeah,
feels. That's
Yeah,
my
no, I-
perception. So I'm just
It's like-
trying to come to an
It's
understanding,
just
like,
you have
when
a
is that
level of
gonna happen?
frustration Board of Finance is a level
And
of
I can
frustration
understand that.
Because of the history, okay?
Yeah,
So,
It's the progress. So, for the next year or two, like Sal said, the progress is we're getting better. Was this last year was what, 790,000?
763 or something.
790 FY 22.
790,
790, year before 935, 875. So I mean, listen, if we could start dropping that a little bit each year, 100 grand, 150 grand. If we see progress going in the right direction because we came up with a great plan and we're all on the same page, that's all we're looking for.
So I mean, like my objectives, and this is from when I've taken over, it's like, what's your 5-year strategy? You have to have a strategy. Usually 5-year plans
Well, I
are what
gotta
you're seeing in
say-
business. And then looking at funding and financial management is the other key component of this VNA, retention and staff. Obviously, I don't think that there's a retention issue. There's very
No.
low staff turnover, which is fantastic in today's healthcare market. And then obviously marketing and what that strategy is to get those referrals, which is going to drive your census and help the bottom line. So that's where I
So
see.
let's say this, let's just say common sense wise, so 2-3 years from now, right? Ooh, well,
Is that us?
Don't always, man. So let's say 2-3 years from now, a year, 2-3 years, I don't know, whatever number, we don't know, but we're still at $900,000 loss. Would you all agree that there's a problem somewhere? We're gonna at some point take some action because.
I've already started taking it.
Yes.
No.
Agreed.
No, I'm
Absolutely.
saying-
I
I'm
can
saying-
agree,
No,
yes,
that's-
but I
that's
think
agree.
we
have,
need,
but Of course, we haven't seen the results of that yet. right?
Yeah,
So
no,
I'm
not
saying
yet.
At the end
Yep.
of this fiscal year into the next fiscal year, 2 fiscal years go by and we're still at the same level. I mean, this is going on since 2011. We've given
Mm-hmm.
it this much time to correct itself and it hasn't. And. but
So why
we're
don't,
still-
we can come up with
Yes.
Goals.
We want.
Yeah, I mean, I don't know what
We
we're
can do
working
it,
towards if we're not
but
giving goals.
we
and
can talk about it and then make a
No, we'll
presentation.
figure it
with
out,
the
but there's no,
Yeah.
it's hard to give you a go, you know, it's just keep kind of chipping away at it so it goes down. I mean, that's really what we're hoping to see, and we keep.
Don't
the same
forget, we're a
level.
small town,
Yeah,
$1 million is almost a mill on your tax rate.
Right.
it's a big.
And Sal and the council have to explain to the voters why their taxes went up. If that sustains that. The voters may be happy paying it. I don't know. I don't know every voter, but it's got to be transparent and they got to know what's going on. And
I think the next step for you really is understand what's in the current budget,
Mhm.
okay? And then based on what you think you're gonna change or whatever, we're gonna start another budget cycle now.
Well, that's
I
the
know,
thing, we're
I've already started
it
on the
for
budget.
Next year, right?
Which
So-
worries me when I'm hearing
Yeah.
budget cuts
So
and we haven't been
understand
given the
first what you have
opportunity.
in your current budget that you're, operating,
Mhm.
and then figure out what your intent is for the upcoming budget cycle. With keeping in mind how we're gonna improve things, and what changes are you gonna make in order to improve, the loss condition in the next budget cycle.
Mhm.
I mean, I could tell you, I can give you a number. I can be arbitrary and give you a number, but I'd rather be fair and say, tell me what you're gonna do first.
Okay,
You know what I'm saying?
well, I can respect that.
All right, I think we've had a very good dialogue. Does anyone else have any comments, any questions for the good of, whether behind you first was, go ahead. Yes,
Antoinette.
there you go. Yes. It's just,
I'm Antoinette Pager, and I was a social worker here for about 28 years. I came in 1984, and I've worked with the Berlin VNA since I walked through that front door. This is an agency that a lot of you, I don't think, have realized that over the tenure that I have put in with this town, this agency has been a hot potato alternately for a long time.
Mhm.
This is an agency that in their organization, in their being, in their soul, has faced at one point or another threats of elimination by various people in this town
Absolutely.
in various methods. And when you have lived with that over the course of time, I have lived with that and know what this agency has provided. That's when I'm coming to the 6:30 meeting because I need to hear. I think that if everybody could keep that in mind, it's no excuse, it's no, let's not dwell on it. But I think the people that work there know that better than anybody.
Mhm.
And the staff that you have that have been through that are much more sensitive to the misleading statements, the what ifs, the whatevers. And I think if we can all kind of keep that in mind and do that as an underpinning for all of us, that we're not talking about it's going to happen tomorrow, number one, but we're also not denying what's happened in the past because it's been a tenuous situation for this agency for years.
Yeah.
I would say probably 3 times during my administration, there were possible changes and threats, if you will, of changing the charter, that kind of thing. For whatever reason it wasn't always the same reason. It was not, I think that the concept of the agency was never to be a money-making agency. From my perspective, from my time with the town and my work with the finance director and everything over those 28 years. It's also something, and I can understand Kara, right? Kara's instant knee-jerk reaction comparing it to a golf course, because that's putting a square peg in a round hole, because it's a totally different body. It's a totally different mechanism. It's something that organizational wise, it's an orangutan. I mean, it's just not something that you could put in a model. And one of my questions is, has anybody done any research, and is there any other way to operate this system? I mean, we don't know that.
That's what we're asking for.
Well, that's it.
Yeah.
That's it.
From our
And-
professionals. Yeah.
Exactly,
Yeah.
exactly.
Yeah.
I can see where, you know, I mean, Doc McIntosh would roll over in his grave 6 times at looking at that deficit. But he also would have
That
said,
he would, yeah.
but he also would have said, but wait a minute, is part of this a service to the town versus part of this being an economic responsibility? And I think that's some of the history that I could contribute to. And I'm happy to do that, and I'm happy to work with anybody that would like some of that history to go along with this, as long as I'm around. It's just a matter of trying to understand the two forces that have finally come together, the frustration of working since 2011 and trying to get answers. I know because I lived through the many heads of Pearl and VNA over the period of time. I used to help manage 2 or 3 of the grants originally because they couldn't get the act together in order to do it. I mean, it just was something that they weren't used to doing. It's a service organization. It's a, you know, it's not.
Not a bean
nuts and
counter,
bolts.
taking care
Yeah.
of people.
Yeah,
Yeah.
exactly.
Yeah.
And when you talk about, I mean, these aren't board of directors, these are board members that are on the board. And I think if I had a board that I was responsible to as the director of social services, if I thought that my board could give me any advice as to how my budgeting should go, I would ask them, but I wouldn't look to them to be responsible for that. And maybe adding an agenda item on every meeting saying, let's just review the budget, where do we stand? How's this gonna go forward? We're working on this goal, how are we gonna meet it? Just to kind of have that on a constant, fill it in. And if you don't have anything, no comment this month, so that it's there in front of them. It would be another metric that you could work with. So that's just where I sit. And where I'm feeling. And I think your explanations have been very helpful. And the fact that it's not eliminating the VNA. It's changing the approach to it. And perhaps if there had been this discussion before it even became a question on the ballot, it probably would have been very.
Well, you know what, you said the best thing though ever of all of it. The VNA was founded when?
1926, I think it is.
26? And you just gave a long
30
history.
years.
It's
From my
still here.
perspective.
It's
Yeah.
still here.
That's right.
And
That's
that,
right.
but
That's a
that's
testament.
good.
It is good.
It's still
It's-
here and we're not looking to,
And it was
be
one of the
there to get
top
rid of
notch
it,
ones
so.
in the whole state. when
yes, no,
started
I
it. mean,
no, but I mean, it's still here.
Yeah, And I
you know,
think trying to do something,
Yeah.
again,
Well,
as
do
you were
something.
saying, reporting
I'm sure.
the incidences of people not being given choices.
Yeah, that's a problem. I'm sure that's a problem.
It's a problem.
I know
It's
it's a
known,
problem, you
yes.
guys. I know it's a problem. Let's face it. The giant in the room is gonna
I
beat up.
remember Gene Conway running around making copies of things when it started to happen at Newport General years and
Oh,
years and years
yeah,
ago.
yeah.
And just getting our flyer in the office. for
Right.
the discharge
Having a
planner was
liaison.
because of territory. I mean, it's just one of these things that has just evolved over time, and it's kind of like, okay, they've had enough, you've had enough. But a
It's
meeting
not,
of the
it's not
mind.
legal. It's not legal. If
Right.
somebody's breaking the law.
I agree with that. And I think whoever sits in the state senator seat needs to be brought on as well, as a advocate.
But also
Thank you.
looking forward to January, there's a new OASIS, which is a Medicare assessment, which is going
that's
to have
awesome.
about another
Another thing.
30 minutes of time. There's going to be a significant impact on the productivity of these other agencies.
I listened, I
And
read the
so-
minutes and I listened to the Board of Finance meeting when they discussed this as the last item on the last meeting. And I see where people got the tag of, well, they just said, okay, if they don't do what if it gets voted down, we're just gonna, we have no alternative but to cut the budget. They didn't say it that way. And I think that's where part of that came from as well. And as long as there's time, as long as there's space to kind of work together and create something, I think we'll survive it. Everybody will. And I think it'll be a better agency. That's
Yeah.
all.
Anyone else have anything? Any other members, the audience?
Follow that.
Right, exactly. That's a good close. So,
Okay.
thank you, everyone. I will adjourn the meeting. Thank you all for attending tonight.
Thanks for
Thank-
having us.